It's a few days away now from November, which is Lung Cancer Awareness Month. So here today to talk about ways we can prevent and treat lung cancer, we have Dr. Jeremiah Martin here from Southern Ohio Medical Center. Thanks so much for coming
Hello.
in.
Thank you so much for having me. It's a pleasure.
Yes, this is such an important topic here, but I never really associated it with November. What's the connection?
Right. So we generally, throughout the year, have various diseases that we highlight at different months. November is Lung Cancer Awareness Month. Lung cancer awareness is important because the disease is still very prevalent and a very lethal disease if it's not caught in time. But if we catch it early, we can cure it. So our goal in November is to get people thinking about it, talking about it, thinking about risk factors, thinking about catching it early, reducing some of those risk factors. So really stemming the tide, turning the story.
Right. Get those conversations going and to go in for screenings. Talk about the CT screenings.
Right.
How beneficial are these, and what can they really catch things?
Yeah, absolutely. So for folks who may be at risk for developing lung cancer, so if you're a smoker, certainly consider getting screening. Talk to your primary care doc. We've got some guidelines on the screen there and the numbers that you can call. But in short, a CT screen is a non-invasive test. It's a CT scan. There's no needles. You lay on a table. Takes less than a minute to get the information and allows your doctor to see inside the lungs. If we find any small nodules, certainly 1 or 2% of these nodules end up being cancer. These are early stage and can be cured when we catch them at that stage. So that's why it's so important. It's the first technology that really allows us to catch lung cancer right as it's getting started.
I noticed you said the word cured. That's very reassuring to hear.
Very much so.
Talk about some of the latest advances.
Right, absolutely. So there are 3 treatments for cancer. I'm a surgeon. I specialize in that. And we have chemotherapy and radiation. All of our treatments have improved. Surgery has become even more minimally invasive with very small incisions, short hospital stay. In chemotherapy, we talk about personalized therapy, where we're able to test your cancer, and oftentimes there are specific treatments for that cancer. Likewise, radiation, which for many patients was, and still sometimes can be, a prolonged treatment. For these small early stage cancers, if it's appropriate, it's just a few short treatments and get you back on your feet. So all of our treatments are much better, and again, much easier to employ when we catch these tumors at a very small stage. Okay.
All right. What do you tell people who say vaping is a lot safer than cigarette smoking?
Right. So I'm not going to lie. When e-cigarettes first appeared many years ago, we as cancer doctors had hoped that they might be better than cigarettes. But its history repeats itself. Yes. If we think about the middle of the last century, smoking was the cool thing to do. All the movie stars did it. It was the thing to do. But 50 years later, we realize the dangers. We see lung cancer, heart disease. We're starting to see those same diseases with vaping. It is not safe. We're seeing COPD, emphysema, and it's only a matter of time before we see the cancers and other issues. So what I tell my patients, we live in this beautiful part of the country and world. Get out there, enjoy the fresh air. The only things that should go in your lungs is fresh air.
That sounds great there. What does SOMC offer in terms of lung and health screenings? Because this is a good month to remind everybody some of the things they can get checked.
So again, we want people to think about getting screened or talking to a provider. Talk to your family provider. On the screen there, we're showing our main contact number. It's 740-356-LUNG, L-U-N-G. And that will connect you with our lung navigator. We have a dedicated team that will help you understand if screening is right for you and help get that set up. So one of the important things at our organization is navigation and the personal touch. It can be a complex pathway getting through the diagnostic workup, but we take you by the hand as we get you through that process.
Oh, that's wonderful. Well, Dr. Martin, thank you so much for stopping by and getting us thinking and hopefully talking and taking our loved ones to get those screenings.
Wonderful. Well, thank you so much for having us, and wishing everybody a wonderful holiday season as we head towards it.
Terrific. Thank you.